ABG kit and use the plunger to eliminate excess heparin and air from the syringe. Suspend the arterial pressure monitoring alarm. Trace the tubing or catheter from the patient to point of origin before connecting or reconnecting any device or infusion, at any transition, for example, new setting, and as part of the handoff process. Needleless sampling access device or a syringe. Disinfect the needleless connector on the sampling port of the arterial line. Use vigorous mechanical scrubbing for a minimum of 5 to 60 seconds, according to the organization's practice, with an appropriate disinfecting agent. For example, 70% isopropyl alcohol, an iodophore such as povidone iodine, or greater than 0.5% chlorhexidine in alcohol solution, and allow the solution to dry. If using a disinfecting port protector or cap, remove the protector or cap from the needleless connector. Discard the protector or cap in the appropriate receptacle. Attach a sterile needleless sampling device. Do not force connections and avoid workarounds per the organization's practice. Turn the stopcock off to the flush solution. Discard blood specimen. Obtain the discard blood specimen using a discard volume of at least 2 times the dead space of the catheter. Use a discard volume of 6 times the dead space of the catheter when obtaining blood for coagulation studies, particularly activated partial thromboplastin time from a heparinized arterial line. If using a sterile syringe, gently aspirate the discard volume. If using a vacuum tube, attach the sterile sampling device to the needleless connector. Insert a specimen vacuum tube into the sampling device, allowing the device needle to pierce the tube's rubber cap. Obtain the discard volume and remove the vacuum tube. Dispose of the syringe or the vacuum tube in an appropriate receptacle. Obtain the blood specimens. If using a sampling device, insert and remove the required specimen vacuum tubes in the laboratory's recommended order. If using a sterile syringe, attach the first syringe to the needleless connector. Gently aspirate to obtain the required blood volume for the test. Attach the syringe to a transfer device. Insert the specimen vacuum tube into the device, allowing the device's needle to pierce the tube's rubber top, drawing the required amount of blood into the tube. Repeat the procedure for the remaining specimens using a new sterile syringe each time. If obtaining a specimen for ABG analysis, expel any air bubbles from the ABG syringe and cap the syringe with the cap included in the ABG syringe kit. Using the fast flush device, flush the remaining blood in the arterial catheter back into the patient. Turn the stopcock off to the patient. Using the fast flush device, flush any remaining blood from the sampling port into a sterile discard syringe or into a blood specimen tube. Turn the stopcock off to the sampling port. Remove the sterile discard syringe or the discard vacuum tube and dispose of it in an appropriate receptacle. If using a disinfecting port protector or cap, place the protector or cap on the needleless connector according to the manufacturer's instructions. Closed arterial blood sampling system. Slowly and gently pull back on the blood withdrawal reservoir plunger until the reservoir is full. Close the stopcock by turning the handle perpendicular to the tubing. Attach a needleless cannula to either a sampling device or an ABG syringe. Cleanse the needleless connector using vigorous mechanical scrubbing for a minimum of 5 to 60 seconds, according to the organization's practice, with an appropriate disinfecting agent. For example, 70% isopropyl alcohol, an iodophore such as povidone iodine, or greater than 0.5% chlorhexidine in alcohol solution, and allow the solution to dry. While holding the base of the blood sampling port, push the needleless cannula with the attached sampling device or ABG syringe into the blood sampling port. Insert a specimen vacuum tube into the sampling device, allowing the device needle to pierce the tube's rubber cap, or obtain an ABG specimen via the syringe. After obtaining the blood specimens, hold the base of the blood sampling port and remove the needleless cannula with the attached sampling device or ABG syringe from the sampling port by pulling it straight out. Open the stopcock by turning the handle parallel to the tubing. Slowly and smoothly re-infuse the reservoir volume. Flush the system using the fast flush device. Turn the alarms on and ensure that the waveform returns. In the presence of the patient, label the specimen per the organization's practice. For an ABG specimen, record the percentage of oxygen therapy, respiratory rate, ventilator settings, the patient's temperature, and the time the specimen was drawn on the laboratory request form, according to the organization's practice. Prepare the specimen for transport. Place the labeled specimen in a biohazard bag. If the specimen requires ice for transport, place the specimen in a biohazard bag, then place the bag with the specimen into a second biohazard bag filled with ice slurry. Immediately transport the specimen to the laboratory.